All right, now we're going to have our panel. So we'll invite Kurt Gillenberg, Jordan Janz, Tyler Joynt, and Jacob Seachord to come join us up here on the stage to the hot seats. All right, so maybe to get us started, you can just briefly introduce yourselves again. I know we all know you, but tell us a little bit about yourselves and your experience with the stem cell transplant, and then we can open it up to some questions. We'll start with Jordan.
Hi, I'm Jordan. I was diagnosed at 8 months old. I did the trial in Chicago for 7 years for the Procysby pills, and then I had a stem cell transplant in 2019 and a kidney transplant in 2022. Overall, everything's been pretty good. There's definitely been a change from before to after. Right now, I'm doing good. It's been a kind of chill life, not really sure if I have to worry or not worry. It's been good.
Hi, I'm Jacob. I was transplanted, what day was it? It was November 16th of 2020, so that was fun. I couldn't have anybody in the hospital with me when I got transplanted because, COVID was still real big. Let's see, I was diagnosed when I was 4, so a little later than most people, but my parents definitely helped me through that when I was younger. And let's see, well, I forgot to mention I'm 26. I'm from Washington State, and I work at the shipyard, so working overtime a lot, which is fun now, especially since I don't have to worry about my Procysby anymore. So that's been a real life changer, and I've been feeling great. I've been plenty of energy. Haven't really had any problems, so that's always a real big, so that's me.
I'm Tyler. I'm the black sheep, number 4. I'm 35. I was transplanted, I think, almost a year after Jacob. The COVID restrictions were a little bit better. My wife was actually working at a hospital near UCSD, so she would get to come by every couple days and see me. We had a 2.5-year-old at the time, which I think was a great age because he didn't really understand why I was gone, but we still got to FaceTime and stuff, so it worked out a lot better. And we lived in San Diego at the time, so the follow-ups were great. I got to go home and drive to the follow-ups after a little while. I'm actually feeling great. All things considered, I'm about to start back on, I think, 2 or 3 pills twice a day of Procysby, see how that goes. Been, otherwise all my blood levels and everything are great. Just the vector copy number and the white cell cysteine is not acting exactly as it should, but it's much lower than it was before. The whole process, they didn't really talk about the process, but it was a lot easier than I expected. I think most of us got the mouth sores from the chemo, which was the worst part for me. I was in the hospital for, I think, 21 days. And I think we're all about 3 or 4 weeks. The Jacobs, where it is, it's an incredible hospital. I mean, it's state of the art. I think it's only 5 or 6 years old, so it's coming from the military hospitals that I've been going to recently because of my wife. It's quite different. The people were incredible. I mean, I had a massive TV in my room, which you're not used to having. I'm sure you guys, when you get admitted, you have like a little TV in the corner that gets 4 channels. So the process itself was great. I mean, the chemo wasn't fun. The actual stem cell transplantation was very anticlimactic. It was just like a little tube like this big that they do like manually, and someone has a timer. And I mean, it's much less fanfare than you expect, which is awesome because it just happened. But yeah, it was really cool, and I really hope everybody gets a chance to have some kind of deal like this.
Hey everyone, my name's Kurt. For those of you who don't know, I'm 31 years old. I've had 2 transplants. My second transplant was in 2019, which has been really successful, no issues. My first transplant had a lot of problems with it. And then the process for me was pretty quick. 2 years ago, after 3 years ago, I think I'm not good with time anymore. I went to the Day of Hope for the first time in like a decade. I went a lot when I was a kid. Just, things happen. You become a teenager. You get busy. can't travel all the time. But luckily, as an adult, I got a little more free time, and especially with work was always understanding. So I was able to come back, and I had heard about this stem cell trial right when Jordan had basically started it, and I thought it was amazing. The fact that even like back when I was diagnosed at about 18 months in like 1993, that was just not even in the realm of thinking that'd be possible. And it just shows how even just in the last 30 years, so many things have happened, and it's amazing that what medical science can do, really. And so I was transplanted in October of 2022, on October 23rd. And the process, it really, like Tyler said, it wasn't as bad, but it still wasn't fun. It really is intense. The chemo, even though it's a short-term chemo, it's still chemo. So you're going to still have those same kind of side effects. And all of us kind of had different ones. Like, I actually didn't have too many mouth sores. Really, for me, I couldn't taste my food for a few weeks after, just because of the, I forget the term for it, but what happens after you have the chemo, your mouth starts to get really like thick kind of mucus around your tongue. So for me, I couldn't taste food for a couple of weeks after I got out of the hospital, which was disappointing, because when you've been eating hospital food for about 19 days straight, you really want something a little better, a little more fresh. But like Tyler said, the process was great. The people there, it's a great team at UCSD, and they're so focused on making sure you are comfortable, that you're as happy as you can be in the situation you're in. But yeah, they've got a nice big TV for you, always there, really 24/7. They're really there to make sure you're as comfortable as possible, because there are going to be times you're not going to be comfortable. So, like, the best advice I can give, if anyone has, which I hope many do, have the possible chance to do it themselves, they kind of prepare themselves mentally and physically, because it is going to tax your body, and it's going to take some time to recover. And sometimes that can be a little frustrating, especially when you're a young adult or a kid and you just want to go out and do things with your friends. You just got to remember that you got a responsibility, you got to take care of yourself before you can have fun. But you will get your freedom eventually, so don't dismay too much. But yeah, it was a really good experience for me. And it was doubly the good experience because I kind of, but during the testing to make sure I was healthy enough to do the trial, I had an echo done, and a little something popped up on one of my mitral valves in my heart, in the mitral valve of my heart, and I had a little more testing, and there was a big 1.2 centimeter growth of calcium, and it was intruding on my, it wasn't doing any major effects. I didn't have any symptoms. I felt totally fine, and I had an echo done right before my transplant, and my second transplant in 2019. That apparently on the I can't remember the test I had, but on the images it showed a little bit of a calcium deposit, but I wasn't told that, neither in my family. So I guess this had been just kind of growing steadily over about 5-6 year period. But luckily it did not hinder me at all from doing the trial. Had no effects. My kidney did really well in the trial, no issues, and I just had the calcium chunk actually removed in October of last year. And our biggest worry as my family was you can get how I was told is you can get as much images as you want of the heart and all the intricacies of it, but you won't really know how bad it is until you get in there. So they couldn't really give me a straight response if they were going to have to remove my mitral valve. That was planned in case they had to. But luckily, I had a really great surgeon, and they were able to get all the calcium chunk and not have to have a mitral valve for the rest of my life, which was great relief. But even to more of their shock, and again, all my EKGs, my echoes, they were always clear. That when part of the process of getting any kind of open heart transplant, you have to have a cath done so they can look into your arteries of your heart and make sure that they're good enough for transplant, because you're going to be under for a while. You're going to have a lot of stuff hooked up to you. Not for transplants, it's going to be for heart surgery. So much to their surprise and the doctor's surprise, when they went in there to look at the calcium chunk, they looked at my arteries, and I had 2 major blockages in my arteries. And we were shocked about that because I didn't have any symptoms, no high blood pressure, no high pulse. You know, I work out 5 days a week. So it was very shocking. They really couldn't give me a straight answer of why it happened so early on. Like a 31-year-old with 2 major blocked arteries is pretty rare. They believe that it might have been just from elevated cysteine levels I'd lived with my entire life. But again, they really weren't sure. But, you know, so really this trial has saved my life twice. I mean, I could have gone for years not doing anything about this calcium chunk and something horrible happening. And of course, when they did another cath, they had seen that the chunk had grown to about 1.4 centimeters. According to my doctor, it starts to be serious when it's over 1.2. Because some people have growths in their heart and they can live with them depending on the size, but anything over 1.2 they want to get rid of immediately because it just makes you at risk for an ischemic event that could really, and as a young person, I really do not want to have an ischemic event before at any age, especially being in my 30s. So it was something that my doctor really wanted to get rid of, and they did, and it was successful, and I'm very thankful for this trial for not only making me feel great and with this and with the stem cells, but also showing like you should probably get this taken care of too. So, but yeah.
All right, we'll open it up to the audience for your questions.
Thank you. Hi, sorry. How many pills would y'all say you have to take now compared to what you used to have to take? And which pills do you take?
Luckily, by the time I had my stem cell transplant, I had already had a kidney transplant, so my medication was pretty low. It was really only my transplant meds, which is just, which was, and blood pressure medication, which is probably about 6 pills, maybe twice a day. So not really anything. And it's about the same now. With my heart surgery, I have to take a couple extra things like aspirin every day, but that's not a big deal because it's a tiny little pill. So still, I think I take about maybe like 14 pills a day, but that's like 7 and 7, and I don't have to take all the same pills. And even after the stem cell transplant, one thing I was taking a lot was thyroid medication. I was on 3 times a week, but after I think about 6 or 7 months, my doctor took me off it. So that's one less pill, and it's been about almost a year since he took me off it. So that's one pill I don't have to take anymore. So
I take 6 in the morning and 5 at night. I have like the CellSup Prograf transplant and then prednisone and just 2 blood pressure pills, and I'll be going back on 2 or 3 Procysbi, so not many at all. It's been very weird. I always feel like I'm missing pills and they look a lot the same, so it's really confusing, and I am really bad about putting them out ahead of time, and every time I do, I'm like, oh, I'm gonna make this for the next month and have these little tiny boxes, and then I don't. So, but yeah, it's like 10 pills a day. It's awesome.
And how many before?
Before, oh gosh, 30 something a day, I guess, maybe more than that. Yeah, it's quite a difference.
Okay, sorry, I was counting on my fingers earlier, seeing how many I take a day. So right now I'm taking my microphenolate and Tacro, which totals to about 5 pills total for those for the anti-rejection. And then I'm taking calcium, so that's just, so usually I take 6 day and night, but every now and then I have to take like, I forget, but some other vitamins every other day too. So compared to, which I think that's about 12-ish a day, depending on if I have to take more vitamins that day or not. But before I was taking, let's see, I think that adds 12, so 12 more before the transplant, if not more if I can't remember anything. I think more, probably, I'll say 13 more before transplant.
So before the transplant, I was on about 56 pills a day. 32 of those were Procysbi. And then I got the stem cell transplant, and they got rid of the Procysbi, and I was just on like my kidney medication, sodium, bicarb, magnesium, vitamin D, those kind of things. And then I was on a couple different pills for to help like my stem cells grow and keep me healthy. I think folic acid and a couple other ones. And then after about 2 years or even a year, I think we stopped those. And then I was just on my kidney medication again. And then I got the kidney transplant. And then about after a month, we stopped all the sodium and KFOS and all that stuff. So then I wasn't on any of those pills. I was just on my anti-rejection. So now I'm on, so I was at 56 pills a day before, and now I'm on about like 20 a day, and that's just my anti-rejection, steroid, that kind of thing.
I have a question for you guys. So part of the treatment is to get the chemotherapy beforehand to make room in your bone marrow with the busulfan, and one of the side effects of that is loss of fertility. Did any of you undergo any like counseling for fertility and family planning before you did the stem cell trial?
Yeah, before I did, I think it was like, because I think it was a year before I was considering it. We actually went to a doctor and I had that test done, and it didn't show anything, but then they said they could go on with another test where they actually like, I forget what it's called, but like where they actually go in and can see if there is, like kind of going a little deeper, I guess, and see. And that was a pretty invasive test, I guess, and I would have been down, they said like 6 months. And honestly, I think I need to look after myself before I need to look after other kids and my little ones. So, which, yeah, it'd be awesome to have kids, but I don't know, I think that's kind of gone now, but if I had something viable in like the first test, I think I would have went for it, but showing nothing in the first test and then maybe do an invasive one and be down for 6 months, I kind of been down too much in my life to worry about that, so I just went for it. Yeah.
So I did tests beforehand, and there's, I think I did it like 6 months beforehand. There was nothing, but thanks to everyone at the study, they got me in touch with a doctor that was going to be able to do, I totally forget what it's called, but all I know is it kind of sucked afterwards. So they basically had to go in with a needle and take out, because it was active inside, I guess. And I had that done about, what was that, like 5 days before I had to go in the hospital for my stem cell transplant. And that wasn't very fun because I did not want to walk around like at all. But I mean, thankfully it was all, it went well, and now they're all in storage, frozen. So if I ever wanted to take them out, I could use them to have kids.
I just want to say that we were able to do that for the patients because the Cystinosis Research Foundation funded the eggs and sperm harvest, for the patients, because that was not included in the grant.
So I actually went through this about, 7 or 8 years ago. My wife and I decided to start having kids. I will get on my soapbox. If you have boys, get them tested as soon as you can. It's probably awkward, but the sooner the better. You can freeze their sperm, as soon as puberty. Do that. I was not necessarily told that with my doctor. So we went through all this, like I said, 7 or 8 years ago. I did all the biopsy and all that stuff, and they're like, "Oh, we got one sperm." And if you know anything about that, most people have like 30 million. So we're like, okay. So both of our children are sperm donor babies, and I mean, you wouldn't know that they're not ours. They're blonde and super, super white. So thankfully I didn't have to deal with any of that before because I'd already done that. But yeah, it's pretty awesome that was part of it. They're like, hey, we'll get you tested and all this before you do it if you want to, because we have no idea what's going to happen.
Yeah, it's funny. When I was a teenager, probably around like 16 or 17, I was told that all cystinotic men are infertile. So the odds of me having any kind of children in the future were like 0%. And then a few years later, I learned it was actually possible, but I had just kind of accepted the fact when I was a teenager. Like a lot of us cystinotics do, we kind of accept the fact that we kind of come to grips with our mortality pretty early on in our age. And so I didn't think anything of it. And then when I was informed that the trial offers this program, and I'd never really planned on having kids, and I thought, well, you never know, things change. Like my sister For her entire life, she swore, I am never having children. I can't stand children. No, thank you. And then now she's 29 years old with a 1.5-year-old and married. So shows you what people change, you know. So I actually did it, and Jacob, I can't believe you did that 5 days before. Because I did it about a little over a month before, and I hate it every day for the next 2 weeks after, because it's, as you can imagine, it's uncomfortable, and they give you this weird underwear to wear after, which is also uncomfortable. I think I wasn't even fully healed by October 23rd. But I can't believe I don't want to think about that. So, but yeah, I did it, and I didn't have a large sperm count. It was pretty low. In fact, the doctor told me it's good we're doing it now because, sorry, TMI. Your right one is failing, and it's probably going to die soon. So it was good they did it when, and they got some out. Not very much, but enough. So I'm glad I did it because you don't really have an excuse to worry about it because they take care of the money, and I think they freeze it for like 15 years, right? So, and honestly, I'm 31 now, so if I am going to have kids in the next 15 years, it would be the time I decided that. But also it's good because if you don't use it, they use it for research, so.
Thank you so much, and you guys are all 5 of you are heroes up there, and it's just so emotional to even see you, and it just thank you, first of all. But I was wondering if you could speak to, I think it's really helpful that you shared like some of the tangible differences in your lives, like the difference in the number of pills that you're taking and things like that. I'm wondering if you could speak to the quality of life changes that are harder to see and count. And I'm thinking of how the burden of living with a terminal illness has potentially shifted now that you've had access to this transformational therapy.
One thing, if you're on the Facebook pages for cystinosis and patients and parents, you'll kind of notice that we all have similar things. You know, we all kind of started the same way with throwing up, excess amount of drinking water, and then other things down the road, Fanconi syndrome, knock knees. But one thing I've learned just being on the forums and pages is that cystinotics go through like I went through something different than compared to another person. I've seen people just go through every single different type of medical issue, and everybody is, it's one of the reasons why I think cystinosis is so like mysterious, because everybody goes through different things, not one person. Yeah, you'll have similar symptoms, but one person will go through something you never had to deal with. Like personally myself, I've never had a problem with speaking or any kind of muscle issues or swallowing. Like I know some people really suffer from that, especially as you get into, I'm 31, so as you get older, you start to have those symptoms worse. But so when I was a kid, like I said, I've had 2 transplants. My first transplant when I was just before I turned 18, when I was a junior in high school, and that had a lot of issues. And even when you get a kidney transplant, you still have cystinosis. It's not like a cure for cystinosis. But you feel a lot better just based on the fact you don't have to take as many medication. Of course, you still have to take. I'm old enough to where I was on Systagon right when it came out. And then I was part of the original studies before they came out with the time-release medication, Persispi. And just like not having to take the Persispi is such a huge difference. I had a lot of gastrointestinal issues even after my transplant, and after I had the stem cell, they really decreased. And I'm not sure if that's because of the stem cell or just not taking Persispi. But I feel great. I feel like I have so much energy. I work as a clinical nurse in pediatrics and adult. I'm actually going to behavioral health in the next month, which will be a completely different experience for me. But I wouldn't be able to do my job if I didn't have the energy. And even after the stem cell transplant, I felt my strength go up. And it wasn't noticeable at first, but after a few months, I started to notice myself lifting heavier and really feeling good. And it really does make a difference. It really does make a difference in how you feel, and it's like I said before, it's just like 30 years ago, this was totally unthinkable, and even in just the last probably, I don't know, probably like 5 or 6 years, the stem cell research has just gone just so funded, so well funded, and so needed that now Dr. Turkey's can't find the word for it, protocol as like that we see it now helping other diseases, which is just amazing, and hopefully it helps even more diseases, and it's I just feel great, and it's just I really feel blessed. I really feel lucky to be the patient, especially being like the last of the first was kind of an overwhelming experience because you know that there are people who just can't do it, and that's not their fault. It's just everybody's different. Everybody's bodies are different, and what's nice is every patient they've learned, and they've tried new things with me. They tried a lot of new things, and they all really did well for me. So I just feel very lucky.
Yeah, like you said about the drugs. Even if I think you had told me going in, well, you're going to take half as many or a quarter as many, I'd be like, let's do it, because I mean y'all know Persis B is awful. So I'm not necessarily looking forward to going back on it, but it's such a little amount that I'm not too worried. One of the big intangible things I think is when you see a new doctor, you don't feel as much of a burden to explain like every little thing about cystinosis to them, because I know that like they don't necessarily need to know about that. It does make things a little confusing because they're like, so you've had kidney transplants and the stem cell transplant. What's that about? Are you cured? What does that do? So it is interesting trying to explain it, but it is a lot less of a burden of like making sure they know exactly what they need to do and all that. And as always, all the doctors have been super, super supportive, especially Dr. Grimm, who I've never actually seen as a patient, but he's been super helpful over the last like 10 years with, either getting me to take Persis B the right way, or most recently, like literally emailed me on the side about my drug interactions going back on Persis B, and just like the whole community of doctors is extremely, extremely helpful and, close knit to a degree. And it's just awesome that now that I've had this, even more so people are helping with that. But yeah, the whole thing has just been. I'll send it to TRICARE. It'll be a while.
Sorry, my mind just went blank for a minute there. But personally, a lot of my problems were before I had my kidney transplant. I had a lot of problems as a kid, as a lot of us do, and like they were saying, everyone has different problems. It's not same. We have some, similarities, but a lot of us deal with a bunch of different things. But before my transplant, I was already fairly healthy, but of course I still had to take Persis B and all my other medications. And then of course you always had to explain to people, like when they're like, oh, do you want to go out and eat? And then I'm like, well, you see, wrong time. Can we go in like another hour? Which is hard to explain sometimes if you don't know the person. But after the transplant, I was, not taking medicine, so that helped a lot. Didn't have to worry about time, just had to worry about the time for like my normal anti-rejection meds. It seems like I had more energy, and I don't know if that was just because the transplant, or if it was because I wasn't taking Persis B anymore. And then feels like I can get stronger a little easier. I can build more muscle a little quicker and without as much pain. But I'm still sore. So after workout, so my mom said she's definitely noticed a difference. Sometimes it's really hard to tell because it's been like gradual sometimes with some of the stuff, and but I mean, quality of life definitely a lot better. What else was I going to say? I think I can think a little bit clearer, I want to say. And I probably because I'm not on Persis anymore. And yeah, that's what I got.
Yeah. So yeah, like before the stem cell transplant, I always thought I felt good, but you don't realize how you feel until after you actually feel good and look back. But before the stem cell transplant, I guess you could say I puke and rallied a lot. So I would go and sometimes days I'd go to work and before work I'd throw up, or I'd get to work and I'd be working, go to the bathroom, throw up, and I'd come out and just keep working. And nobody really knew at work or anything until I kind of told them, or if they asked, or why was I in the bathroom, 3 times that day, it's because I was throwing up, but I wouldn't say anything and just kind of go back to work, and that was just my life. And then I got the stem cell transplant, and it's not like an instantly you feel better thing. It takes time, and I didn't notice until I guess my mom would point out little things. I know there was times where she was just like staring at me, and I was wondering why, and she's not, my eye color would change, but she said my eyes looked clearer. She noticed just from looking at me, which I thought was kind of weird, I guess, but. And then, yeah, quality of life has definitely gotten better. Yeah, I'm still taking pills, but it's, people look at me now and say, oh my God, you're taking all those pills. It's like, dude, you should have seen it before. And it's definitely gotten better for sure. Yeah, I have a kidney transplant. Yeah, I'm dealing with different things now, but it's I guess it's a work in progress. It's just slowly changing, but it's definitely getting better for sure.
Hi. First of all of you, thanks for being comfortable enough to talk about what you're talking about up there. That's taking courage, and we all appreciate it. I know Erin said it, and I'm going to paraphrase her again, because I just want to ask the question in a rapid-fire, sort of quantitative way. Pre-transplant versus post-transplant, rank 1 through 10. How happy are you about it?
It's a good question. So pre-transplant to post-transplant, honestly, I'd say I'm definitely happy about it. I'd say 10 out of 10 for sure. I'm happy about doing it. If I guess if I got it and maybe I had to go back on pills or eye drops, maybe I wouldn't be a 10 out of 10. But I'm definitely, yeah, I guess a 10 out of 10. If someone asked the question, would I go do it again to maybe get my vector count higher or something like that, right? I honestly don't think I would do it again, even if I had to go back on, say, 2-3 pills a day. I know they say it was an easy process, which yes, it kind of was, I guess, but there was definitely unexpected things, and it was hard. I'm gonna say for sure it was hard. Chemo was hard. There's a lot of testing. You have to be ready for the testing. But now with I think the stage 2-3 trial, there wouldn't be all the testing there was for us. They definitely cut it in half, I'd say for sure. But yeah, I'm for sure happy I did it.
Yeah, honestly, yeah, 10 out of 10 for me too, because it's but when I was deciding if I wanted to sign up for this stem cell trial, I sat down with my mom and dad, and we just talked through what are the pros, what are the cons, and we were talking about how yes, I'm healthy and I feel pretty good right now, but what will I feel like in another 10 years, or just another 2 years, something could happen, involving cystinosis. And in my opinion, the testing was definitely, it wasn't easy by any means. You had most of the day, every day, you had to do testing, eyes, biopsies, blood draws, meeting with doctors, lots of stuff. It definitely tires you out. For me, it wasn't too bad because I'm just kind of used to going with the flow. I don't be if they're like, oh, by the way, this changed, I'm like, whatever, do what you guys need to do. I'll just go along with it, and if you ask, personally, I didn't have a whole lot of problems when I was in the hospital, but yeah, I'd probably do it again in a heartbeat if I had to.
I would say a 9.9. Going back on Persispi isn't going to be fun, but again, 2 pills a day is I would definitely go through that process again. Like they said, there were fun times and not fun times. The testing for me wasn't bad because I've been doing that all my life, and The main thing is all the weird eye stuff that I'm like, why does this matter? Why are you poking my eyes? Just take the pictures. That's kind of my downfall. I'm sure there's much less data for me on the eyes than anything else. But yeah, I would say, basically a 10 out of 10. I would definitely do it again on a heartbeat if I needed to, for sure.
1 out of 10. No, I'm kidding. Definitely a 10 out of 10 for me. Like I said, it's technically saved my life twice. But yeah, no, the testing is definitely hard. And unlike Jacob, who was responsible and discussed this with his parents, I did not. I literally got an email about it, and I immediately said yes without consulting at all. And then like a week later, I'm like, oh yeah, I forgot to tell you guys, I signed up for the stem cell transplant trial. And they're like, what? But my parents, as you know, as all of you parents of cystinosis out there, you've seen your child suffer, and that's just and it's really hard to watch. And my parents' biggest worry was that all this testing, the chemo, was gonna really kind of bring it kind of brought back some memories from my mom that weren't really her favorite. And when I was a child, with dealing with all this and the issues I had with surgeries and things like that, and my dad was all for it. My mother was just really nervous because she just didn't want to see me go through something for nothing. And I kind of had to convince her a little bit that, over the years of after, this was about a little over 3 years, I think, after my second transplant. And she just didn't want anything to happen to the new kidney, and she didn't want to see me go through pain. And I just kind of had to convince her, after 3 years of having the kidney and building myself back up and getting stronger, I just kind of felt that it was just like God was kind of calling me to do it. And she of course like bit her tongue and was biting her nails the whole time I was going through this. And like Jordan said, the testing is not fun. It's a lot of eye exams, and they do some eye exams that I never thought were even possible. And I really like Tyler, I could not do most of those except for the regular pictures and things like that. But everything else I could do, but it's still not easy. Chemo is chemo, and you kind of got to prepare yourself that you're not going to feel good. It took a bit for my levels to drop after the chemo. It was kind of funny, because they're telling me now you're not going to feel good after a couple of days, and it's been like a week and a half. I'm like, I feel fine. And then after about 2 weeks, I woke up the next day and I'm like, oh yeah, there it is. But I'm really glad I did it. I would definitely do it again if I had to. I wouldn't enjoy the process of doing it again, but I would definitely do it if needed.
Dr. Cherokee, I wondered if you could comment on your hypothesis for what would lead to a higher vector copy number versus a lower, or if it's just basically luck and chance.
So as I said, we use the HIV vector, so it's a virus. And actually to go inside the cells, it uses the HDL receptor. So we are not all the same, on this receptor. And actually patient 5, we couldn't get the vector inside the cells. And we tried to find if there was mutation into the receptor. We didn't find any. So that's the issue of a gene therapy, is that it's really a custom medication, and you cannot predict beforehand what will be your vector copy number. Even if we optimize the best protocol, we all respond differently because the virus use a receptor that we have on our cells to get inside the cells, and we are not the same. So, we do the best, optimizing the protocol, but not everybody will respond the same, and there is nothing, I mean, we get better and better because now there are additional molecules you can use to get easier entrance of a vector into the cells. So, I don't know what will be used, on the next step, but there are ways to improve, but still we won't be able to predict.
All right. Well, thank you so much to our panelists. Go ahead.
One more thing. Is this on? One more thing real quick. My mom did a whole blog throughout the whole time of testing, and I'm sure some of you have seen it. I think it's on her Facebook profile, Rocky Seachord. It detailed everything that I went through, basically. She was really good. I told her what I did for the day, and then she typed it all out. So if anybody's interested in reading that, it should be on her Facebook profile somewhere. If not, I can always text her and try to get like where it's at. If anybody's interested in that, just come talk to me.
Thanks, Jacob. All right.